So in our colposcopy seekhe, I am putting up some of my cases for your learning. So we will be starting cases and I'll be telling you about the sweet score, how to identify the lesion, although there might not be any lesion in these cases. So first of all, a quiz. A 44-year-old woman present to the healthcare provider for an evaluation. She was notified that her pap smear revealed atypical squamous cells which cannot exclude HSIL, and she is HPV-16 positive. She presents for further evaluation with colposcopy. Her vitals are stable. Her history is significant for cesarean delivery, gestational diabetes mellitus, and PID. What are the most concerning findings for cervical dysplasia? So it is a simple question, and you should be able to answer it. One is the ASCH pap smear, HPV-16, the need for colposcopy, and being 44 years old. So in this case, HPV-16 is the most discerning factor for these women. This factor combined with age of 44 years is very, very important because this shows that the HPV infection, that to particular 16 is consistent, it is persisting, and that is why it might lead to precancerous lesion which we need to treat. So this is the case number 1. You can see this is magnification of 6 and this is magnification of 9. Here you can see the part of the cuscos. So normally one should not be able, one should not have the cuscos seen during the colposcopy because it can reflect the light. And then this is 9 magnification. The same thing here, the cuscos is eliminated. So what we can see is that patient here, new squamocolumnar junction is clearly visible, and here is one Nebuthine follicle which is being highlighted here. There are multiple vessel scenes here. The cervix is, ectocervix is dusky. It is clearly dusky here, and if you see here, again it is dusky, giving dusky appearance is there, and it bleeds on touch because of the marked vessels present. These are not abnormal, these are branching. You can see tree-like branching vessels. So they are absolutely normal, nothing abnormal in this. Now, after applying of the with the green after saline, and then we are seeing this in the green filter. Again, the Nebuthine follicles, the area is very clearly visualized. Here you can see that the changes, metaplastic changes are going on. Here also the metaplastic. I have not included acetic acid images for here right now, so as to show you the geographical distribution of the margins. See, the margins here are not very sharp, their geographical distribution, and the type of the color the Lugol's iodine takes. So this is mahogany brown here slightly because of the, as I told you, here it is dusky and lot of blood vessels are seen. That is why it hasn't taken the iodine has not been taken properly in this area. But as per the guidelines, now they are saying that you should take the areas, you should biopsy the areas also in such cases where acetic acid is, which is a acetic acid whiteness in the on the acetic acid is visible, and Lugol's iodine is not considered to be very sensitive, but if you want, because CIN2 and CIN3 are heterogeneous, they're asking us to take the multiple biopsy. One could take the biopsy from this particular area. So what we suppose, because we have not done the, I'm not showing you the acetic acid images, so we cannot calculate the sweet score. But in this case, the acetic acid uptake was 0. The margins are diffuse, vessels are very fine, regular tree branching, and there is no lesion. And iodine staining is brown, only one this area. So faintly or patchy yellow is seen here, so we can give it 1 score. So the sweet score is 1 and hence of no significance. So this is case number 2. Again, I want to highlight that this is a magnification. Magnification is always seen when you start the timer. So this again I want to show this. This is 8 magnification. This is the 17 magnification. When you increase the magnification, then the part of the cervix only is visualized. Okay. So here the type of the transformation zone. In the other case number 1, it was type 1 transformation zone. Here the type transformation zone is number type 2, because lower limit of the neoscamocolumnar junction is not seen. So what is the transformation zone? The upper limit of the crypts or the Nebuthine follicles which are seen on the ectocervix. We draw an imaginary circle all around that, and that becomes the from here, from this place, from the neoscamocolumnar junction to that circle, imaginary circle which exists, which is taken when the last crypts or the Nebuthine follicles are seen. Although the Nebuthine follicles are seen mostly in this area, the crypts can be seen. So that becomes the squamous-scamocolumnar junction. So old scamocolumnar junction is now squamous-scamocolumnar junction, and this is the new scamocolumnar junction. So the transformation zone in this is type 2, because the lower limit of this is new scamocolumnar junction is not seen. Here again, I have increased the magnification, and you can see that under the green filter, there are no abnormal blood vessels. Small, these punctations are seen although here, and this is enlarged view. We have most of the, we are not, this is enlarged to 17, and you cannot make out much. And so this is blood vision. Whenever you are increasing the magnification, you need to shift the colposcope a bit. And now here we have applied the Lugol's iodine. So what I wanted to show you is that this area is mahogany brown, and this area is not, it hasn't taken the iodine as it should have taken, like this. And I'm not showing the again the acetic acid image right now. I wanted to show you the Lugol's iodine. So one should take the biopsy as per the newer guidelines from here. Again, the margins of the new scamocolumnar junction, you can see they are very diffuse. So if you calculate the sweet score, because I have not shown again the acetic acid uptake, and without that the sweet score calculation is difficult. But so it was in this case, there was only shady or the milky uptake was present here, and the margins are diffuse. So the acetic acid uptake score is 1, margin score is 0, vessels fine regular, that is again 0, lesion size here, so it is almost between 5 to 15 millimeter. So 1 score can be given, and iodine stain is faintly or the patchy yellow. The score in this case, because of the acetovite uptake, your lesion size and iodine staining is 3, and we have to take the biopsy from this area. So this is case number 3. Again, just to show you the type of the ectopy. When the type of this type of ectopy, which is covering almost whole of the external os, then you see the type of the vessels here, and this is the enlarged view. This is also enlarged view. This is also enlarged view. Here I wanted to highlight you the branching nature of the vessels, and plus there is ongoing squamous metaplasia at this outer end, not in the inner. Here is the squamous metaplasia. You can see here the small tiles are being formed. So this is the type, the metaplastic changes are going on. You can easily see them much more. Here again you see the metaplastic changes are going on. And then see again the vessels here, branching type of the vessels. So this is absolutely normal. And type of the color, this is mahogany brown and yellowish color. Here it seems to be a little bit canary yellow, but so for the newer doctors who are practicing new or learning the colposcopy new, they can take the biopsy from this area, because this area is a bit canary yellow, and this one. Otherwise, if we calculate the sweet score, it is on this basis the sweet score is only 1. So this is case number 4. Again, just to show you the type of the cervix, again you can see that this is neoscamocolumnar junction, and the cervix is very dusky because of the infection. And there are few Nabothian follicles seen here. Okay, this is neoscamocolumnar junction. If you can make it out, and the transformation zone is type 1. Here is the Nabothian follicle inside the columnar epithelium. So this area must have undergone the changes earlier also. That is why this Nabothian follicle is present here. This is under 8 magnification. This is under 15 magnification. Again, you can see it is a dusky, a small crypts like openings are seen. These are the crypts. So how to see how to measure or locate the transformation zone from the new scamocolumnar junction till the last crypt is seen on the ectocervix. You draw the imaginary line. So this is here we can see the small crypts. Here also this crypt is seeing, here also these crypts. So we draw imaginary circle around that and then assume that this is a transformation zone, and we have to look changes in this transformation zone. The maximum changes will be going around in the new scamocolumnar junction. So this is the same case which I am showing you here. Yes, it is the same case. So now you can see easily that this is a new scamocolumnar junction. This is a 15 magnification. This is 8 after application of the acetic acid. Here I have applied. So there are crypt openings. You can see more clearly here. Okay. And this Nabothian follicle. And again, this is 1 minute 22 second. It is 1 minute 5 second. So you can see that this is they have taken because the metaplasia is going on, it has taken the aceto-white area, acetic acid uptake is there. And again, you can see here, this area is a bit more is whiter than compared to this area. And here lot of crypt openings are being formed. And this is the Nabothian follicle. So this is the type 1 transformation zone. And here you see that whole of this has not taken the iodine, unlike other slides. And this is more brownish as compared to this. So this is not a normal finding that the iodine has not taken. Might be the problem with the iodine also. But since it has not taken, we need to take the biopsy as per the latest guideline.